Hello, this is Dr. Schmo from the Functional Neurology Center and the Brain Health Online Summit. And as a part of our mini series in functional medicine and TBI, I'm here today with Dr. Meagan Kirschling, who is going to be talking to us about hormones and how they can get affected after traumatic brain injury and what kind of findings, patients might see when their hormones are off, some simple things that they can do at home potentially, and then also what are the lab tests that people need to have performed to look at hormones and their function. So super excited to have you here today.
Yeah, excited to be here and talk about this.
Yeah, I mean, we just see so many patients that have these hormonal changes after traumatic brain injury. So I'll let you kind of take it over and go from there.
Yeah, well, one of the things I actually like to do to sort of start a conversation about TBI and traumatic brain injury and hormones is even give some of my background because both of these worlds are two worlds that I just think are so fascinating and I'm passionate about. And traumatic brain injury, my first real exposure to it was when I worked as a civilian with the Army.
Okay.
And I was over in Germany and worked 4 years over there with the Army. And really obviously, because we were in an infantry unit, saw a lot of TBI. And that was in about 2010. And I think it's really interesting because at that time, which was just 10 years ago, we were told by the higher ups in the TBI clinic that traumatic brain injuries weren't a big deal, that if there were immediate effects and changes, then we needed to really like zone in on those. But I remember actually going to a meeting and a doctor there said, after a year, there was no such thing as a TBI. So if you were a year out, no matter if you'd been treated, no matter if you still had symptoms, no matter the severity of the TBI, that we didn't have to worry about TBIs going past a year, which obviously the way you and I think, Dr. Schmo, that is just like, what? Like, I don't know what is magical about the 365-day mark. And honestly, to tell you the truth, we weren't really even treating them the right way. And for a lot of people, we were just going after symptoms and just started telling people that some of these severe symptoms after severe TBIs, I mean, these individuals, unfortunately, were experiencing a lot of them downrange, which included, getting blown up and things like that, that they just weren't connected to a severe event. Well, obviously, that doesn't resonate with me, doesn't resonate with you, and it doesn't resonate with anybody that has had to go through all the effects of what a TBI does to a person. And so I would say one of my major passions, though, is hormones. I just really, really think they're such an integral part of wellness and health in general. And a lot of times we don't talk about them with TBI, but we need to because a traumatic brain injury is really an overall effect on the body. There's not just the localized effects with the brain and that part of the actual injury, but when we look at it, there's so many central nervous system changes. And hormones are one of the major ways that we communicate in our body. And it's one of the major ways we compensate in our body. And so, whenever there is a traumatic brain injury, we see so many changes in these hormones. And a lot of times, we don't address them and we don't go after them and we don't look at them. And that really makes it hard for us to get ahead of all of these changes that have happened because of the fact that we're not looking at the hormones. And so when we talk about traumatic brain injury, I just think there's such a conversation that needs to happen around hormones and the changes and the things that we can do there in order to be able to get somebody back to optimal well-being.
Perfect. We see a lot of patients that after traumatic brain injury, they do a lot of rehabilitation. So vestibular, visual, balance, cognitive training. But if those things are not changing your symptoms, there could be underlying, either neuroinflammatory issues, changes in the gut, which we'll talk about on this mini series, as well as these hormonal changes that overall are affecting your brain neurochemistry, which could be giving you some of those visual, vestibular, balance, cognitive symptoms, correct?
Yes. And so we do know, looking at the systemic changes of a TBI, that there's changes almost immediately in that brain gut axis, like you talked about, the hypothalamus pituitary axis, and that communication between the brain and the hormones and the production of hormones. The hormone by far that's most researched is progesterone. And we know so much about progesterone and head injuries in the last like 15, 20 years. And I think even just talking about the progesterone link just shows how dynamic this is. Yeah. Because when we look at progesterone, I think some of the first research, I don't know if it was the first research, but early research nonetheless, was about looking at mice and rats and looking to see how they best responded after a head injury. And we started to notice that women mice and female mice did better than males. It probably was theorized at that time that a lot of that had to do with estrogen, just because we think of estrogen as sort of this powerful woman hormone. But when we looked into it closer, we realized, because we did a little bit more research about even sort of pseudo impregnating mice and giving them higher levels of progesterone, that it's progesterone that has that neurocognitive protection. And that immediately after head injuries, we start to see changes in the hormones that lead to more cerebral edema and inflammation in the brain. We start to see more inflammatory, what are called cytokines or inflammatory markers. And we can decrease these immediately with using progesterone, because by being able to help balance out those hormones and not letting some of these cascades and events occur, that we have such a powerful tool to be able to slow down that inflammation, stop that inflammation, and rebalance the body. And the sooner we do it after a head injury, obviously, the better the outcomes. Mm-hmm. And because hormones are such a communication part of our body, where we use it to communicate with so many processes, and all of our hormones sort of communicate with each other. I mean, our progesterone talks to our estrogen, it talks to our testosterone, talks to our DHEA, and it talks to our adrenals and cortisol. That when we can make a change in the hormones, that's where then we can start to be able to get ahead of some of these other things that are occurring in that big picture of what can happen with a TBI. And so that's where I think a lot of times we don't look at hormones. We don't think of them right off the bat, mm-hmm. but they really do make such a difference and are such an important part of the conversation.
Okay. So say you're somebody and you're like 4 or 5 years into your TBI and you still have lingering symptoms. What hormones need to be assessed? And like, how do you do it? Do you do it through blood? Do you do it through mm-hmm. salivary? Like, how do you do it?
Yeah, I love this question. I think it's so important because I think it's different for each person. And unfortunately, for people trying to find answers, it just has to be individualized. But I think that this is something that a lot of people ask, and it's good information to know. So when we talk about this, I will be honest, blood hormones don't tell us a ton. There are some that we can get better markers with, like testosterone, DHEA. They're a little bit better indicators in the blood than some of the other ones, because the bound up hormones sometimes do not tell us really where you are functionally. The two best options by far are saliva and urine. And I actually use them individualized for a person. Okay. So when we talk about salivary, usually I will use salivary a little bit more if I feel like you're maybe a postmenopausal woman and you have lower levels and I want to see what's really getting to the cell at that moment. Salivary also gives us a great 4-point cortisol, so we can see what your adrenal glands are doing. And the salivary cortisol by far is the best. So if I'm really worried 4 or 5 years out that this is now adrenal driven and you're just in this huge stress response, I'm going to push a little bit more for salivary so that we can see where you are right now and what we can do. There's also a great indicator for progesterone. And that progesterone marker is important post any kind of head injury for a man and a woman, because it's really that first step in hormone production. So if you're not producing enough progesterone as a man or a woman, then that's where we need to start with that progesterone pregnenolone sort of component. Yeah. Now, if you come to me, because the other thing about TBI, which is a blessing and a curse, is TBI is also a time where we'll start to see where some of those weak links were from before. Because you might have been this ticking time bomb, that there might have been a lot of other things going on and you were just sort of holding on. And then you have this systemic TBI, and all of a sudden we start to see really some of those weaknesses that were before that now you can't compensate for because of such an injury to the body. Mm-hmm. And so if you come to me and you say, well, I've never had regular periods, I've always been hormonal, I've had all these other issues, and I start to really think a lot of those pathways have been off for a long period of time, I'm going to push a little bit more towards urine. Urine is going to be the breakdown a little bit more of the actual way that we break down hormones. It's going to show us a couple other indicators that we don't get in saliva. One of the bigger problems 10 years ago was that if we chose urine, we didn't get that cortisol pattern, that 4-point. We'd only get a moment in time because we'd have people collect for 24 hours and we were just sort of seeing the compilation of the 24 hours. Now through the Dutch test, which a lot of people know about, and being able to use urine that way as just a spot test, we can actually get some cortisol component and adrenal insight too. So depending really on your symptoms and your history, not just the traumatic brain injury, but the whole picture, that's where I'll sort of choose between salivary and urine testing.
All right, perfect. I love it. Yeah. So, I mean, a lot of the people that we see, obviously they have a lot of fatigue. So fatigue, like what are some of the symptoms that patients see when their hormones are off that you've seen clinically?
Well, I also tell everybody, because I've really come to conclude that our nervous system, our immune system, and our hormone system should be all one system.
Mm-hmm.
I think we separate them because it's easy to learn it that way. It's easy in a book. It's great textbook sort of learning and education. But really, all three of those depend on each other for that compensation. And so when we start to see a major injury to the nervous system in the brain, that's why we see all these changes in the hormone system and the immune system. Why all of a sudden you and I are dealing with, chronic Lyme disease, mold, and, Epstein-Barr virus and other immune concerns in people that have had head injuries more than some of the other populations. And why we definitely start to see more hormone issues come up with traumatic brain injuries, because once there's been a blow to one of those systems, there's going to be changes in all of them.
Yeah.
So when we look at like hormones and we look at that part of it, we really can see across the board that especially as you get further and further out from that traumatic brain injury, you've started to have to compensate your day-to-day living in order to get by. And the hormones have been a major part of that. And so that's going to then start to talk to your neurotransmitters, and it's going to start to lead to anxiety, and it's going to start to lead to depression, fatigue, and the kind of fatigue where it's not like, oh yeah, it's hard for me to get going, or I'm just not motivated at 3 p.m. I can't get off the couch kind of fatigue.
Yeah.
I will say that sometimes I get people that come in that have all these hormone changes, and a woman hasn't even changed her cycle. Like she still is 28 days. And she'll say, my cycle hasn't changed. I don't think it's my hormones, because you may be getting that 28-day communication. Okay. But on a day-to-day basis, you're just really faking it till you make it in the hormone world. And so we go in and look at saliva or urine, and we can really get a good picture of what is not sort of playing its role the right way, so that you aren't behind that 8 ball when it comes to hormones. And so these people do come in, especially after a head injury, and just feel like their whole world has been shaken and they can't do anything to sort of get their feet back underneath them.
Yeah, 100%. Yeah, I think every single person is 100% obviously different with their symptoms and what they have compared to somebody else. So, we'll see patients that will come in. A lot of the people that we see in our office have already done like a lot of the functional medicine stuff prior to coming in. So they'll come in, they'll have full lab work. They've seen 5 different people. So our role is to do neurorehabilitation, to stimulate the nervous system, to try and get it to integrate. And it's amazing to see what kind of hormonal changes happen in the body just after stimulating the brain. In some patients, though, you have to do the neurorehabilitation, and you have to get more specific with trying to figure out, what underlying could be going on. A lot of people have general things that they do prior to coming in, like they'll be taking vitamin D and curcumin and fish oil, and they've cut out gluten, they've cut out dairy. But I think with doing the lab testing that you're talking about, you can just get more specific and clean up the whole, functional medicine aspect to it. Combine that with doing the neurorehabilitation. That's a really good program right there.
Yeah. And the nice thing is too about the body is that we, unfortunately, I think in traditional medicine have really tried to make everything in a vacuum. Like, oh, you have a head injury, let's just look at the head. You have hormone issues, let's just look at the hormones. But that's why it's so important. I think a lot of times I tell people this all the time. If something goes wrong with me, I've got to go to somebody to have them help me, because there's so much going on. And, we both have had health issues, and like we go to other people, and because somebody has to put it together for you.
Yeah.
And looking at all of this and looking at this component is that a lot of times we can start in a lot of different avenues and make a big difference. Even with everything off and saying, yeah, your hormones are like this, we don't have to treat everything in a vacuum either, and we shouldn't. So the cool thing about all of this too is that it's really something where, I think you and I work really well together, because we both know when we are sort of stuck in our world and can say, hey, listen, like you need to go to Dr. Schmo and you need to do the neuro part, because you're not going to make any change until you turn on that nervous system. Yeah. And same thing, like, we've been doing this long enough that where it's like, okay, you're stuck on something else. Yeah. And how are we going to help put this all together? Because humans are complicated, beautiful creatures, but injury really, I think two things, like I said before, is really has to have a comprehensive, individualized approach to get you back to where you need to be. And two, a lot of times, any kind of injury or stress response really does a lot of times sort of shine on some of the things that were happening before, and some of the things in your health that needed to be addressed, but you didn't realize it because you were getting through day-to-day life.
Yeah, 100%. So in terms of, we check people's hormones, we see things that are off. What do we do? I mean, I know everybody needs an individualized approach, but are there like specific things that you do that can help with hormone levels? Like, are we doing, specific creams? Are we doing sublingual? Like, what are we doing?
Yeah, I do think too, not to sort of sound like a broken record, but that being individualized sort of has to be a little bit. But first of all, the one thing I will say everyone can do after any kind of head injury, in a place that's sort of safe to start, is two things. I think that there is obviously over-the-counter progesterone creams. They're usually wild GAM based and are easy to get. That's a good thing to do, because there's such a neuroprotection that comes with progesterone. And so that's something everyone can try, and it is safe. As a woman, I usually tell women, try to sort of, if you're still cycling, even just use it on the second part of your cycle. So 2 weeks after you start bleeding. Men can use it all the time, but a lot of times I think that we don't realize both men and women produce progesterone in their brain. So there are progesterone receptors, and there's progesterone production in your brain. And it's a calming effect, which is helpful, because when you're in this neuroinflammatory process, that progesterone can help to calm and help with GABA and the neurotransmitters to be able to help healing a little bit.
Yeah.
I also think just because of where we are environmentally and where I see people all the time, a lot of us tend to be estrogen dominant and get more estrogens no matter what, whether we're a man or woman. So I do think it's important to, while you're doing this, to have a little bit of estrogen support. And there's some great supplements that do that. And so DIM, just DIM, N-3-carbinol, calcium D-glucarate, and there's a lot of combinations of that you can find, are great ways to get your estrogen level down so that you can also get your progesterone levels up.
Okay.
And they're very safe to do. You don't necessarily have to be under a functional medicine doctor's guidance for that. And then if you're really depleted, that's when we can use bioidentical. And we can start to use bioidentical in order to get those levels a little bit higher, to get you a little bit more balanced. But that would be something we'd want to do after we tested you specifically and said, okay, this is where your levels are at. This is what we need to do to help augment changes. And so that's another option out there too.
Perfect. So basically, in some individuals, we have to just kind of work on that hormonal aspect to get some sort of balance there, and people will start to see changes, and then we might be able to go in and more effectively like heal their gut or do neurorehabilitation or take care of some sort of underlying inflammatory or infectious based issue. Is that kind of what you've seen?
Yes, especially like with the progesterone, because like through research, we know that it has an effect on the blood-brain barrier. We know that it decreases cerebral edema. We know that it has neuroprotective components. And the other thing about it is progesterone, because it works with GABA, will help calm you down in sleep. Yeah. So especially then doing it at night, because obviously a lot of traumatic brain injury individuals have sleep problems. And they have problems with that calming down effect.
Yeah.
And so, you know, I do think progesterone is one of those things that is just, the more we learn about it in TBI, the more we're sort of blown away by all of its effects. But it is something then with the over the counter, you could start right away, especially, and I would use it at night because you could get a benefit of sleeping better with it, which is so important for the healing process.
Yeah. So, I mean, a lot of patients that we see with TBI have changes in their cerebellum, and
Yep.
people develop dizziness. So I see a lot of hormone changes related to dizziness and just feelings of people just like rocking and rolling, or, you know, moving their head and having their VOR reflexes be off. There seems to be an underlying change that's going on in progesterone levels and how that affects the neuroinflammatory cascade in the cerebellum, and these neurons called Purkinje neurons, which basically are the whole like kind of inhibitory aspect of the cerebellum and how it gates like the brainstem.
Yeah.
So if you're doing vestibular rehabilitation, if you're doing all these different exercises and you're making changes, and but they're not all the changes that you want, there could be some changes that are going on with those levels affecting gating in the brain. And then you'll see you get those under control, and then people are like, oh, everything looks calmer in my environment. I feel calmer and my sleep is better.
The two other things that I would mention, because I think that they're important, and I sometimes do forget them in the hormone conversation, is omega-3 oils. Not only because of the whole brain component, but a lot of times we forget that all of our hormones come from good fats. And so cholesterol is that first step in hormone production.
Yeah.
And so I really think it's important, not only because of all the brain properties and protection that we get with omega-3s, but also to really, really up the omega-3s, because that'll help you be able to get into a better hormone cascade and pattern. And then also just the things that you can do for your adrenal glands and stress reduction, because the other conversation in the hormone world is how much our adrenals and cortisol play into the whole communication of our hormones. And so when our adrenals are off and our cortisol is off, then that's going to be harder to get our hormones back to where they need to be. And that's everything from, you know, meditation to different kinds of herbs and things like that to help settle your adrenals so that that's not completely driving your hormones in a way that we don't want them to be.
Perfect. All right. Well, I think that was great. I mean, that's a lot of information for people to start to digest. So is there anything else that you wanted to add quick?
No, I just really think the important part is I really want people to realize when they're going through traumatic brain injuries, how much of an effect it has on your overall body. Because unfortunately, I think working with these individuals so many times, they're even told that a lot of these symptoms aren't connected to their head injuries. And they're being told that, well, you have anxiety or you have hormone issues, and these are responses, and they're normal responses to something abnormal going on in your body. So for people just to be their own health advocate and to realize that these things that they're feeling and these symptoms, they're all connected and they're not just isolated events, and to really realize that we can put it all together, and we need to put it all together because especially in the situation of after a brain injury, it really does affect every part of a person and their well-being.
Perfect. All right. So how can people find you? What's your website?
Well, our clinic is called One Agora Health, and we're in Bloomington, Minnesota, near you. You can go to oneagorahealth.com. We are on Instagram at One Agora Health and Facebook. Okay. So those are probably the easiest places to find us, and all the information is there.
All right. Perfect. All right. Well, thank you, Meagan. That was great. And we'll see you next time.
Yeah. Always a pleasure. Thank you so much.
Thanks.